So let's do a rundown of the anterior compartment of the lower leg. The fibula is here and the tibia is here, so this is the lower leg. And the anterior compartment muscles are going to form tendons. So muscles become tendons and then insert into bone. So we're going to look at the proximal muscular attachments and then the distal muscular attachments for the anterior compartment of the lower leg. So in terms of what we are going to need, if we think about the function of the foot, we can dorsiflex the foot. So dorsiflexion means moving in this direction. And we can also plantar flex, but the plantar flexion would be done by things that are underneath the surface of the foot, whereas things that act pulling up the dorsal surface will produce dorsiflexion. So the great toe is always special. It always needs its own tendon. And the digits need their own tendons as well. So what you can see here already is a little muscle that starts on the anterior process of the calcaneus and has 4 slips to the lateral 4 digits, so to digits 2, 3, 4 and 5. And this represents a little muscle called extensor digitorum brevis. So it's quite a fleshy muscle that you can see on the lateral surface of your foot. The tendon that looks like it's part of it is actually not, because there's no 5 tendons in a digitorum. So this is the extensor hallucis brevis, and it has its origin off the extensor digitorum brevis, and its distal insertion is into the great toe, and specifically around the MTP joint level. So all these tendons sort of insert around the MTP joint level. So this is not an anterior compartment tendon. It's not starting in the lower leg and crossing the ankle. It's an intrinsic foot muscle. But the reason I've put it there is so that it makes more sense later when we talk about the longest version of that muscle. So what's in the anterior compartment of the leg? So one of the largest dorsiflexors that acts on the ankle to produce dorsiflexion is a muscle that begins or has its proximal attachment up here on the lateral surface of the tibia, and that whole upper half, and this is the tibialis anterior. So it's an anterior tendon, it's attached to the tibia, it's a nice straightforward name, and it inserts onto the medial cuneiform and the first metatarsal. So that helps to suspend that medial arch of the foot. So obviously tendons don't just sit nicely in place, they need retinaculums or straps, so we'll discuss those in a minute. But there's your first anterior compartment tendon. So it's the first muscle seen next to this sort of anterior border of the tibia. So it's the first muscle to be lateral to the tibia. So you could palpate that down your shin bone, and this is the muscle that's affected by shin splints, or shin splints is a change that occurs in the periosteum down that anterior border of the tibia. It's quite painful, and I'm sure you'll come across that one day. Now we need something to the great toe, so we're going to put on our extensor hallucis longus tendon now, and it has its origin on the fibula instead of the tibia, and some of the fibers would attach naturally to the interosseous membrane. So the extensor hallucis comes from the middle part of our anterior surface of the fibula, and it inserts into the base of the distal phalanx of the great toe. So I need it to come down just a little bit further. Okay, so the longus is a much longer tendon than the brevis. So it makes sense now why we have to distinguish the two. So we had tibialis anterior, extensor hallucis longus, and now we need something for the digits. So our extensor digitorum longus comes from the lateral condyle of the tibia, the superior 3/4 of the fibula. So it goes a very long way. So you can see it's coming from the fibula and the interosseous membrane, and then it inserts into the lateral 4 digits, It does something a little bit tricky at the metatarsophalangeal joints, but I won't discuss that now. Suffice to say, it's an extender of digits 2, 3, 4, and 5. All right, so it's coming from the medial surface of the fibula. So medial being this surface and across the interosseous membrane. So there's only one left to go, and it's a little bit of a, ghost tendon because not everybody has one. And it's called the peroneus tertius. Tertius meaning the third. And it's inserting onto the base of the fifth metatarsal, slightly dorsally. So you'll remember that peroneus brevis inserts onto the base of the fifth metatarsal as well, but slightly more laterally. So peroneus tertius is seen here, almost looking like a slip of the digitorum. But if you remember that digitorums only ever have 4 tendons, then you'll know that this is not part of it, and nor is this hallucis tendon. So now we need something to hold all these tendons in place. So there's an anterior retinaculum, sort of spans across that distal tibiofibular syndesmosis, so medial to lateral malleolus. And then you also have an inferior retinaculum, which goes from the calcaneus over to the medial malleolus, and then this lower band blends in with the medial fascia of the foot. So the retinaculum are predisposed to injury as well, and when they become injured, sometimes it leads to instability of the tendons, causing extra or excessive movement of those tendons. But that's the anterior compartment of the leg. So let's just revise what they are. So most medial and going lateral, we have the tibialis anterior, and then we have the extensor hallucis longus, we have the extensor digitorum longus, and then finally the peroneus tertius muscle.